Hi, I'm Patty Sear. Welcome to my new video series, A Patient's Perspective for Medical Care. I'm not a doctor or medical professional, but I've been a patient with a lot of health problems over the last 40 years, so I have a lot of insights I can offer you. And I also have been a medical benefits trainer as well as an author of a health-related book. And I have done mentoring for 20 years and still do for those undergoing cancer treatment. So I really do feel I have a lot I can offer. And this is not a series of videos to bash doctors. We all deeply appreciate doctors, nurses, and the entire medical staff who help us out, especially during these COVID-19 days where they're actually risking their lives every day. But I hope you stick with me through this series. I have a lot of great things I'm going to talk about, including making appointments, meeting with doctors and nurses, pain scales, invisible illness, handicap parking, some of the emotional feelings that go into living with chronic illness, even for those who don't have chronic illness. All these tips can be deeply helpful. I'll talk about surgery, post-op surgery, health trends of the future, and a whole lot more. So today I'm going to start out with post-op care and surgical discharge instructions. And these are things that are not often talked about, but are really important. If you go into the hospital and you have, whether it's inpatient or outpatient, when you leave, you're going to be given discharge instructions. Now, I've had over 10 surgeries in my life, and each time the doctor would give me a set of his or her discharge instructions, and the hospital would give me theirs. And in all of the times that I went in, the instructions conflicted. For example, one of my more recent surgeries, the doctor instructions told me I did not have to take any medications, whereas the hospitals listed several I was to take. So what do? It's very confusing to the patient, and this is something I think doctors and hospitals have to pay a lot more attention to. In my case, I called the hospital and they said, well, that's what we feel is the best care. They're covering themselves for their own liability. And then I called the doctors, and of course I followed my doctor's advice, but it is very confusing to patients. So I want to talk, one other thing regarding that where it can get confusing is after that I had went for a doctor visit, and in my electronic file it stated that I had taken all those medications that were listed on the hospital's discharge instructions, when the fact is I had not taken any. And it's important to get those out of the file, because suppose I was allergic to one of them and it didn't state that. It could look like I had taken them and never had a problem. So I told the doctor I was going to start a journey of trying to remove these from my file. And he said, good luck. I think it's going to be almost impossible for you to do that with the way things are these days out there. And I think I've got a pretty good chance of trying to get these out, but it's going to be something else I now have to tackle, and a lot more of my time to get those out of my notes. And we'll discuss office notes during another video. And the other thing I want to talk about, just take maybe 5 minutes or a little bit longer of your time, that's really important, is post-op surgical care. So whether you're going in inpatient or outpatient, this is another area I think doctors need to spend more time with patients before the surgery, so that patient feels when they get home they have all the tools, supplies, and knowledge to know what to do to have the best aftercare they can. You want to know, for example, am I going to need Band-Aids or any special equipment? I needed to buy what's called a knee walker for after one of my foot surgeries. Now, insurance wasn't going to pay, so I talked to my doctor about what might be a good quality one. You always want to discuss this with your doctor. And I bought this about a month ahead of time so I could practice and make sure that this was working out for me. So I didn't just open it up from the box the night before the surgery and be surprised. Are you going to need a neighbor to help you out? Do you need someone to take care of your pets if you have pets? Do you have to elevate your leg when you get home? How high do they want the pillows? And so forth. Do you have rides? If you can't drive, you need to arrange rides for follow-up care or maybe to pick up a prescription? Is there a way you can get your prescription ahead of time? Sometimes that's allowed, sometimes not. So you want to be thinking of all these types of things, and you have people around you, a good support system that can really help you out. So I hope that I've been helpful today, and please tune in next time. I'm going to be talking about visits with your doctor, and I have a lot to go over with that. I may have to break it into 2 series. There is so much that can go on out there that can deeply affect your care that is not often talked about. So thanks for joining me today, and I look forward to seeing you next time. Bye.